Good evening, dear medicos. Myself, Dr.Krishneswari, and our channel is again back. So, we were discussing about the symptoms of neurology. Today, in this fine evening, we are going to discuss about the another symptom of neurology, that is vertigo. So, everybody experiences vertigo. So, in this session, we will be seeing about what is vertigo, what are the physiology behind vertigo, and what are the types of vertigo. Okay, so you will be well versed with physiology, but for proper understanding, we should know the physiology of vertigo. So, first we will go to the definition of vertigo. So, vertigo, it is an abnormal perception. What is the meaning of perception? Is what we understand or what we feel. It is known as perception. So, vertigo, it is an abnormal perception. We all know that vertigo is not normal. Normal person will not experience vertigo. So, it is an abnormal perception of movement. It is an abnormal perception of movement. So, where is the movement? Movement of environment and self. That is, if a person is experiencing vertigo, he feels that the environment and also the self is moving. Understand? Rotating or moving. So, vertigo definition is, this definition is said in Davidson. So, the definition of vertigo is abnormal perception of movement of environment and self. You understand? So, you are clear. Abnormal, it is an abnormal perception. So, what is this abnormal perception? It is a perception of movement. So, what is moving? Yes, the environment and the self is moving. You understand? So, this is the definition of vertigo. Abnormal perception of movement of environment and self. So, we will go to the physiology of vertigo. So, we will make the physiology short, so that we will be easily understanding about the vertigo. So, we know that in vertigo there is some loss of stability. So, in order to maintain the stability of a human, there are three sensory systems acting. So, what are these three sensory systems which maintains the stability of a person? The first is, one is vestibular system. The first system is vestibular system. Second is the visual system, vestibular system, visual system, and third is somatosensory system. Okay, so three systems are vestibular system, somatosensory system, and also visual system. So, first we will see about the vestibular system. So, vestibular system, you don't feel bad. I am not going to the details of the vestibular system. You will be very well aware of that. Anyway, I will say in short. So, vestibular system. So, we will show an example. Okay. So, everybody know what is this? Yes, this is an earphone. But for us today, in this evening, for us, this is vestibular system. You think like that. Okay. So, vestibular system, it consists of a end apparatus. So, you feel this jack is what? End apparatus. So, vestibular system has a end apparatus, it has a nuclei. See, this is the nuclei. So, vestibular apparatus has a, not vestibular apparatus, vestibular system. It has a end, what? End apparatus, then nuclei and also projections from the nuclei. Okay, so it has a end apparatus, and this end apparatus and nuclei, end apparatus, there should be some connection. So, this end apparatus and this nuclei is connected by means of vestibular nerve. You understand? Now, you understand the anatomy. Okay, so it consists of a end apparatus, it consists of a nuclei, and it consists of projections. And this end apparatus and the nuclei is connected by means of a wire-like structure or nerve. Which nerve? Vestibular nerve. Vestibular nerve, or it is also known as vestibulocochlear nerve. It consists of, this particular nerve has two sections, vestibular and cochlear part. So, do you know vestibular cochlear nerve is the which cranial nerve? It is Yes, it is 8th cranial nerve. Very good. It is 8th cranial nerve. Okay. So, let us see where this end apparatus is situated. This end apparatus, it is a receptor-like thing for this vestibulocochlear nerve. This end apparatus, it is situated in the internal ear. Okay, inner ear. It is situated in the inner ear. So, in the inner ear, this apparatus consists of semicircular canals and also otolithic apparatus. So, semicircular canals and the otolithic apparatus forms the end organs. Okay, and this from the end organs, the nerve impulses are carried to the vestibular nuclei in the brainstem by means of vestibular nerve. Okay, okay. Then from the nuclei, there are so many projections. 4 projections are very, very important. Okay, so first projection is to the 3rd, 4th and 6th cranial nerves. First projection is to 3rd, 4th and 6th cranial nerve. So 3rd is oculomotor, 4th is trochlear and 6th is abducent. So we know all this nerve is concerned with the movement of the eyes. So first projection is to this nerves which is concerned with the movement of the eyes, and this is responsible for the vestibulo-ocular reflex. Vestibular nerve and the nucleus, vestibular nucleus, and the 3 cranial nerves which is concerned with the ocular movements, and this projection is responsible for vestibulo-ocular reflex. So this is physiology. Let me say some pathology. So when we are feeling vertigo due to this vestibular, some problem within the vestibular apparatus or in the end organs, the patient will be having nystagmus. This is the point where vertigo is associated with nystagmus. You understand? So this is the connection. Okay. So first projection we have said. Then second projection, the second projection is to the cerebellum. Second projection is to the cerebellum, and this projection is concerned with the modulation of vestibulo-ocular reflex. Okay, modulation. Be very careful. You listen carefully. If you are not understanding this, you cannot study vertigo. Okay, please understand. Please listen carefully. If you are having any doubts, please you can comment in the comment box. Definitely I will give the answer. Okay. So, second projection, it is the cerebellum and it is concerned with the modulation of vestibulo-ocular reflex. Okay. Next, third projection is in the spinal cord. Okay. Third projection is in the spinal cord and it is responsible for the postural maintenance. Postural maintenance of a person. Then, fourth projection. Fourth projection is in the cerebral cortex and it is responsible for the conscious awareness of position of head. Understand? So, first projection, cranial nerve, that is vestibulo-ocular reflex, 3rd, 4th and 6th. Second is in the cerebellum. So, it is concerned with the modulation of vestibulo-ocular reflex. Then, third is in the spinal cord. It is for postural maintenance, and fourth is in the cerebral cortex and this is responsible for the maintenance of position of head during movement. Okay, you understand. Now, we will go to the vertigo then. Now you understand what is vestibular reflex, what is the vestibular apparatus, what is vestibular nerve, what is vestibular nuclei. It is present in the brainstem and the projections. You understand about the anatomy and physiology. Now, this is about the vestibular system. Then, second system is visual system. So, visual system, it is of somewhat, it is not much important as vestibular system, but visual system, by seeing we can spatial distance we can see, and also we are seeing the environment so that we can maintain the posture. And third is somatosensory system. So in somatosensory system, the thing is we will be having some sensory receptors in our joint, muscle and also skin. So, by maintaining the somatosensation, these sensations, we are maintaining the posture. Suppose we are walking in a uneven ground. Suppose we are walking in a uneven ground. So we will be very careful. We will be getting what? This sensation in our soles. Is it not? Soles, joints and all. So we will be keeping our feet very carefully while walking. Is it not? So this is what concerned with somatosensory system. Now you understand, is it not? So the three systems are vestibular system, visual system and somatosensory system. I think you understand. If there is any doubt, please you comment in the comment box. Okay. Then we will come to vertigo proper. So depending upon these three systems, vertigo is divided into two. One is physiological vertigo and second is pathological vertigo. Physiological vertigo and pathological vertigo. So what is physiological vertigo? So physiological vertigo, there is no pathology in that. Normal people will be feeling vertigo at some instances. So when there is any mismatch of these three systems, we told about three systems, is it not? So when there is any mismatch of these three systems, as in car sickness, so we will be going to places like hilly places like Ooty, Munnar and all. So what is the thing in that? The road will be, yes, there will be curves. Road will be having so many curves. So what happens? Our head will be moving in an inconstant direction. It will not be moving constantly. So what happens? This system, there will be mismatch in the system. So we will feel vertigo. Second, when there is flexion. So when there is flexion, hyperflexion or hyperextension of head or neck, such as painting the ceiling and all. So there will be hyperextension of neck and head. So what happens? The person will feel vertigo. These are normal vertigo. Then third is when the patient is spinning. After spinning, we will be feeling a post-rotational vertigo. It is known as it is a physiology condition, post-rotational vertigo. So these are the most important instances which physiological vertigo occurs, and these are normal. So I told about post-rotational vertigo. So we should understand post-rotational vertigo to understand the pathology behind vertigo. So we told that there is end apparatus in the inner ear. In both ears we are having end apparatus, and what happens is these end organs will be producing neural impulses, nerve impulses they will be producing. It is known as firing. So there will be firing of nerve impulses from the both end organs. So in normal persons, what happens is the firing will be neutral. From the both ear, firing will be equal. So suppose what happens is I am spinning. You think that I am spinning. So I am spinning in the right side. Through right side. So what happens is this firing will be increased. My head is moving in the right side. When I am spinning in the right side, my head is moving in the right side. So what happens? There will be more firing from the right sided apparatus, end organ. Okay, more firing will be there. Production of more impulses will be there. So I will be spinning, and there will be more production of impulses from the right side, and at a point when I stops, what happens is suddenly this right side will stop producing impulses, or there will be reduction in impulses in the right side, and what happens? The left side will be starting more impulses. You understand? So in the position where I am spinning, at first from that side, this end organs will be producing impulses. So when I stop spinning, this impulses from the side will reduce, and at the same time impulses from the left side will be increased. You understand? So what happens? I stopped spinning. Suddenly I feel vertigo in the opposite side. Understood? Because now the firing is more in the left side. So I feel like I am rotating towards the left side. So I will be feeling vertigo on the opposite side. Okay. This is post-rotational vertigo. This is the normal physiology I am speaking, and we discussed about the physiological condition which produces vertigo. Okay, done. Okay, then next is pathological vertigo. So we know that there are three systems which is concerned with the stability and posture maintenance of the person. So first, these three systems will produce vertigo. If there is some pathology in all these three systems, they will produce vertigo. So first we will go to the visual system. This visual system and somatosensory system, only small causes are there, but vestibular system is very important. So in the visual system, usually concerning with the visual system, when we will be feeling vertigo, yes, we are using glasses. So eyeglasses, if there is some power difference in the eyeglasses, or we are using mismatched eyeglasses, we will be feeling vertigo. Suppose we are keeping our father and our mother will be having glasses with different powers. So just you take one glass and you keep it. So suddenly you will feel some numbness and you will be feeling like vertigo because there is a mismatch in the visual system. So that is concerned with the visual system. Second is somatosensory system. We told that somatosensory system, the receptors present in the skin, muscles and joints. So if there is any neuropathy due to any causes, there are so many causes which leads to neuropathy, we will talk it later. So you now understand if there is any neuropathy due to any causes or if there is myelopathy concerning with the spinal cord. So what happens is if there is any neuropathy or myelopathy, there is chance of vertigo concerning with the somatosensory system. Okay, then the most important thing is vertigo concerning with the vestibular system. So regarding the vestibular system, we can divide it into three. Okay, first is end apparatus, vertigo due to defect in the end apparatus. Second is vertigo due to defect in the vestibular nerve, and third is vertigo due to central causes or due to brain, something concerned with nuclei and the projections. Okay, so the most important among this is the vertigo concerned with the end organs. Okay, concerned with the end organs. So we told earlier there is post-rotational vertigo normally. So here also it is divided into two, unilateral and bilateral. So if there is defect in one ear or defect in both ears, both will produce vertigo. So we will see what are the causes. So this vertigo will be associated with what? Nystagmus. This will be associated with nystagmus. Usually this is associated with nystagmus. And also in this unilateral vertigo, if there is defect in one ear, one inner ear or one end organ, so what we will feel is there will be vertigo on the opposite side. You understand? There will be vertigo on the opposite side. If there is defect in my right inner ear, then I will be feeling vertigo towards the left. So it will be contralateral vertigo. Very important, the vertigo will be contralateral. And let us see what are the causes of unilateral vertigo. The most important causes are infection, trauma and also ischemia. Infection, trauma and ischemia. These are the acute causes of unilateral vertigo. So regarding the unilateral vertigo in the vestibular system, the most important thing is we will be feeling vertigo on the opposite side. There will be nystagmus and also what? The vertigo, it is associated with, sometimes it is associated with nausea and vomiting. Sometimes it is associated with nausea and vomiting. And the most important causes are ischemia, infection and also trauma. You understand? Now, we will see the acute causes of bilateral vertigo. Acute causes of bilateral defect in end organs. Bilateral vertigo or bilateral defect in end organs. So, the most important cause is alcohol and drugs. Drugs and alcohol are the most important causes of bilateral end organ defect which leads to vertigo. Okay. Now, suppose there is recurrent vertigo. Vertigo is recurrent along with the symptoms of cochlear defects. Symptoms of cochlea, you know about cochlea, no? So, along with symptoms of cochlear defects. So, what are the symptoms of cochlear defects? There will be hearing loss and also tinnitus. Hearing loss and tinnitus. So, there is recurrent unilateral vertigo along with defect in cochlear structures or symptoms of cochlear defect such as tinnitus and hearing loss. Then it is due to Meniere's disease. Very, very important. Meniere's disease. So, there is another condition known as vestibular neuritis. Inflammation of the vestibular neuritis. Okay. So, how will you differentiate vestibular neuritis from Meniere's disease? Very, very important. If the vertigo, there is recurrent vertigo without cochlear symptoms such as tinnitus and hearing loss, then it is vestibular neuritis. You understand? So, the main important difference is in Meniere's disease, there will be recurrent unilateral vertigo along with hearing loss and tinnitus. But in vestibular neuritis, there will be unilateral vertigo, but there is no hearing loss and tinnitus. Okay, this is how you can differentiate Meniere's disease from vestibular neuritis. You understand? Next, there is something known as benign positional vertigo. Benign positional vertigo. So, this benign positional vertigo, it is due to the affection of posterior semicircular canals. So, posterior semicircular canals will be affected in case of benign positional vertigo, and it normally occurs. So, due to the defect in posture of our head. So, there will be in recumbent position, if the head is more tilted towards right or more tilted towards left, what happens is there will be defect in that ipsilateral side in the posterior semicircular canal, leading to benign positional vertigo. You understand? Then, there is something known as vertebro-basilar insufficiency. Everything is associated with vestibular end apparatus. Okay. So, vertebro-basilar insufficiency. We all know that, I think. What is vertebro-basilar insufficiency? So, there will be reduced blood supply in the vertebral as well as basilar artery. Vertebral as well as basilar artery, reduced blood supply. So, there what happens is, it is very, vertigo is uncommon. Very, very uncommon, but very, very rare, but it is not associated with any other symptoms. Okay, it is not associated with any other symptoms, and there is recurrent vertigo mildly, then it may be due to vertebro-basilar insufficiency. So, now you can diagnose vertigo, whether it is vertebral insufficiency, whether it is Meniere's disease, whether it is neuritis, whether it is due to some ischemia of one side or not. So, you understand, these are the vertigo which is due to end organs. Okay, vestibular end organ. The second cause of vertigo in regard with this vestibular system is due to defect in the vestibular nerve. So, vestibular nerve, the 8th cranial nerve, it has another part known as cochlear nerve. So, what happens is, if there is defect in the vestibular nerve, there is vertigo, but if this defect is associated with the cochlear part, then what happens is, there will be defect in the hearing. There will be defect in hearing along with tinnitus. So, if there is combination of both this part, then there will be vertigo associated with hearing loss and also tinnitus. Okay. So, the most important cause of this vestibular nerve defect is neuroma, that is acoustic neuroma or schwannoma. It is also known as acoustic neuroma, and schwannoma are one and the same, or meningioma. You understand? So, this is in concern with the vestibular nerve. Then, third is known as central vertigo, or when there is defect in the central organs, that is the cerebellum or brainstem. When there is any defect, then it leads to central vertigo. The importance of central vertigo is that in central vertigo, there will be associated central organ symptoms. Central organ symptoms such as, that is associated with brain and the brainstem, like diplopia, dysarthria, neuropathies, etc. So the central vertigo, it is concerned with the central organs or organs in the brain or something concerned with this stability in the brain. So if there is some central system, then there should be some peripheral system. So this organs in concern with the central brain which leads to vertigo is known as central vertigo. So then what is peripheral vertigo? What we have explained earlier is the peripheral vertigo. That is vertigo due to the vestibular system, vestibular apparatus, or the end organs of the vestibular apparatus. What we have explained, is it not? Acute, chronic, many years disease, vertebro-basilar insufficiency, this neuritis, etc. comes under what? This peripheral vertigo. So there are some difference between the central vertigo and peripheral vertigo. In the central vertigo, there will not be any tinnitus and deafness, but in the peripheral vertigo there are chances of tinnitus and deafness, and there is something known as visual fixation. So this visual fixation, in case of peripheral vertigo, you ask the patient to fix their vision to a special thing or a particular thing. You ask them to fix their vision to a particular thing. So what happens is, in the peripheral vertigo, this visual fixation will be reducing the vertigo. But in case of central vertigo, visual fixation will not reduce the vertigo. You understand? Nystagmus, it will be present in both. And this will be very acute in case of peripheral vertigo. The vertigo will be very, very acute in case of peripheral vertigo and severe in case of peripheral vertigo. But in case of central vertigo, it is not so severe. Not so severe, and it is of chronic duration. Okay. So these are the major differences. You think about visual fixation one, then and also associated this tinnitus and deafness. Understand, tinnitus and deafness is more in peripheral vertigo, and this visual fixation, we can fix the vertigo or we can stop the vertigo by fixing the vision in a particular object in case of peripheral vertigo. Understand? Okay. Then there is something known as psychological vertigo. So it will not fit to any of this vertigo, and this is a psychological sensation that the patient feels that I am having vertigo. It usually occurs after some labyrinthine defect, and the patient will be continuously saying that he is feeling vertigo, and it is not a pathological vertigo. Since it is not a pathological vertigo, the patient will not be having any nystagmus, and you cannot find any defect in any of this system in case of this psychological vertigo. So these are the types of vertigo. So today we have learned about the definition of vertigo. We have learned about the physiology of our stability. We have learned about the types of vertigo. See, in short, this vertigo is divided into three. All the three systems, is it not? Visual system, somatosensory system, and vestibular system. In the vestibular system, it is again divided into three according to the structures present in the vestibular system, and the most important vertigo or the most important cause of vertigo is the end organ defect. So I hope that you understand this topic. Vertigo we are usually seeing in our clinical practice. So I think that this class is useful to you, so you can differentiate vertigo now. So you have learned about the DD of vertigo, types of vertigo. Thank you so much. Thank you for your patient listening. Awaiting your suggestions. You can put your suggestion and also comments and also doubts in the comment box. Definitely I will answer. So next day we will be coming with another session, that is regarding the, again we will be continuing with the vertigo regarding the how we can evaluate a case of vertigo. So if you are happy with my sessions, please subscribe, share it to your friends. Happy day. Thank you so much.